just to be clear for the layman, like myself, with using the laser, how does it is it less painful for the patient?
I'll let Tom tell a little bit about that. He's got a lot of expertise in the technology of the laser. I do too, but I know.
Well, I've actually published 6 studies. I just had a recent one published in the Journal of Periodontics and Implant Science, where that shows that the laser, the way it works, it kills the bacteria. It goes into the pocket, and it will kill the bacteria almost every time. When people say, well, let's just do scaling and root planing. Scaling and root planing has been shown to the bacteria come back in like 6 weeks. So the laser goes in there because it's attracted to dark pigmented things, and the key bacteria in periodontics are dark pigmented. And so it kills them. And then the other thing it does is that the spatial wavelength, the Nd:YAG laser, biostimulates the stem cells in the periodontal ligament, so we get new bone to grow every time. And sometimes we get new bone to grow completely back, but we always get new bone. Where the old cutting and stitching always lost a little bit of bone. So it's really a breakthrough. Joe and I were trained with the best people to do surgery, flap and osseous, and we did it for probably maybe half of our careers. But now we very rarely would do that, because why would you do that when you've got a procedure that works better and doesn't cause any postoperative pain hardly at all?
Yeah, I agree. And the other thing that the laser does, you see, periodontal disease is a disease of infection. It's caused by bacteria and parasites that lodge under the gum tissue. And they multiply, they give off endotoxins, exotoxins, chemicals that destroy bone, destroy soft tissue, and that's what gum disease is. It's in periodontitis. It's when the supporting tissue of the teeth is lost, and it's basically an infection, a bacterial and a parasitic infection. So the laser will kill these organisms, as Tom said. It kills them. But the other thing that it does is it sort of cauterizes the inside of that gum pocket. So by cauterizing the inside of the gum pocket and removing that inflamed gum, the lining of the pocket, and eliminating the bacteria and parasites that cause the infection, we then have a chance for that gum tissue to heal against the tooth, and for the gum pocket that was there to shrink. So now it's sort of reattached to the tooth, so the gum pocket becomes shallower, smaller, can't trap as much material, easier to clean. And so now the patient can take better care of their mouth because they don't have these very deep pockets that were inaccessible before, because the gum has reattached to the tooth. And that's enormously important.